have a profound discussion, a deep discussion into a phenomena of womanhood, of humanity, of humanhood, right? Because one of the things people don't recognize about this topic of postpartum depression or perinatal conversation is that not only are women impacted by it, also men are impacted by this process. And so it's little discussed. So the first part, I want to just make sure that we understand that everybody's impacted by this process. And so we have profound scholars to discuss their concerns, their understandings of it, and also their experiences with it. So we will let them introduce themselves. So we'll start with Dr. Bruce Golden, and introduce yourself and who are you and what's happening with you in the world.
Yes, hello, welcome. It's good to be here from England.
Are you muted?
Oops, can you hear me?
Yes.
Yes, you can hear me. Good. Yes, welcome. I'm here from England. So my background is in education, but I also have worked with excluded children who are excluded from school. And I'm also a special educational needs coordinator. So the focus is on supporting families and children with their mental health and life events that happen, unexpected life events. So it's good to be here today.
It is good to have you here from the UK, from Binghamton, from where is it again?
In Birmingham.
Birmingham. All right, I was in Nottingham. I don't know. Oh, good. I got you. Okay, Birmingham. So you are indeed a profound scholar. And I really admire how you conceptualize education and our children. So thank you so much for being that person who paves the way to make sure that they have a level of consciousness into who they are. And this is another one of those discussions to enlighten us about being more conscious. Yeah. And next.
Yes, I'm Sister Olorantoyan from Hamburg, Germany. I'm a psychosocial counselor and doing a lot of work here in the Black and African communities, trying to see that a lot of mental health issues are addressed. Here we have a lot of stigma still, people not being able to access healthcare due to resident status issues and so on. So there is a lack, as you know, here in Germany, the community of Black people is not as large as in other places. So there is also a lot of isolation here. And I do my best to organize the different groups, the women, from an empowerment lens perspective that is looking what is in the community and how can we strengthen what we have. Because here the German government and institutions are not really catering to the needs of Black people.
So, I mean, let's start right there. I was not going to start there, but I mean, Black people in Germany, that's already an anomaly, right? But yes. when we talk about empowerment of women in a space where there is a predisposition to disempower or to take away the power of Black people. Mm-hmm. So tell us about your work there and about your work with women.
Okay, so I would start with, like I said, basically, first of all, getting the women to speak out that there's a problem, or even to realize that there's a problem is often one of the places I start. That is with educating a question of depression. You have one part is the healthcare system not catering to the groups of people, so people don't even know they have depression. Yes. And we need to reach out and educate the community through the schools, through the different groups that we try to create, and educate on what is depression, what are the symptoms, what does it look like, and through this try to get the women to share experiences. This identifying and realizing there are several other women who have symptoms like I have is another important factor. So that we building up the support groups that women can come together. First of all, educating what is depression, what do the symptoms look like. We sometimes have, we work with other groups so that the women are referred to us, and then we take them from where they basically are. And this has been proven to be very helpful. There is a problem of racism, of discrimination, and so the layers are sometimes very complex. Yeah, so people have low self-esteem and basically think there is something wrong with me. I'm not learning the language properly. If I spoke German much better, then I would be accepted. But yet you have also, even among the African Germans, those who are born here, who are raised here, who have the German nationality, also are not doing well due to isolation. So when we start with like a lot of events, information events, town hall events, getting communities together out of the isolation, realizing that we are large in number, there are other Black women here who are experiencing the same thing. And this has proven to be very effective as a starting point.
So when we talk about Black maternal health, right, people often overlook something that you mentioned. That is a psychosocial environment of racism and how that influences not only conception, but also influences the process of gestation of a child and influences delivery and birth weight and all of those things. And so you mentioned something that when we talk about even violence, the idea of the emotional violence against a culture, against a person for not speaking their language, or the emotional violence against persons of being deemed to be inferior or less than, right? All of those things are forms of violence. So we ought to think about the idea of domestic or interpartner violence, that how what happens to people in a relationship, but what's happening to me in an environment that is perpetually attacking my well-being, right? My humanity, or in this case, my womanhood, right? And then how do I think about bringing children into that environment? We know that, for example, for quite some time, sharks did not have sharks in captivity. They did not deliver babies because something happened with them. They turned that part of them themselves off. And some say that because they did not want their offspring to be born in captivity. We know that even when the context of enslavement in the U.S., that many times Black women would not be able to have children for some time, or some would even find ways to prevent their bodies from conceiving because they did not want their children to be born in captivity. So my point is that what you describe is something that talks about the elements of violence on women, maternal health and well-being, racism, hormonal shifts and changes. Just before you talk about a child coming out into the womb, they're already being assaulted by the survival hormones kicked in women. So anyway, that's powerful work. Dr. Unati has joined us, and so Kanjani. Introduction. So what's going on with you? What's happening, and who are you? Let us know about your profound work with men and this topic.
Thank you so much, Dr. Kevin, and to the panelists. Hello, everyone, and to our viewers. I am Dr. Unati Makiwane, and the president of Black Mental Health Matters. This is one of our projects that we decided to bring to the community here to empower us, people of Black descent, of African descent, in the African space and in the diaspora. I just got in here when one of our sisters here was sharing about the experiences of our people in Germany. It's not a unique situation. It's happening just globally. My work focuses more on men's mental health and generally men's health. And I think it's a space that is untapped by most of our healthcare professionals. I know we're focusing on women and girl children, which is amazing, but we need to also get to the bottom, the root cause of the pain, because there's a lot of gender-based violence. So for me, I chose to focus on that because I need to understand the space of men. How do they think? And also how do they view the whole dynamic of mental health? So it's been an amazing work. It's been an amazing dynamic. Interestingly, I have this global community of men I coach. Most of them, actually, they are Africans. And I do have also people from other cultures and nations. It's been a beautiful dynamic. And to see that men, they think alike, basically. But of course, us back home in Africa, there's a lot of that patriarchal structure. We need to break those, and also them just understanding the concept of vulnerability that comes with accepting mental health struggles. So it's been an interesting journey with these men, and I'm seeing the transformation that is occurring and them understanding the importance of seeking help. Because one thing we need to understand, and also our viewers to understand, men, when they are depressed, they tend to present slightly differently compared to women. You know, gender-based violence is actually one of the symptoms that comes with depression in men. So rather than bashing them and probably thinking they are cruel, they are actually crying for help. So that's basically why I do what I do, to bring that awareness. So we'll be unpacking a few things here as we go, Dr. Kevin, but I'm happy to be here and I'm happy to contribute to the discussion. Thank you so much for having me.
I'm so happy that you are here talking about men. And I want to begin with this part of the conversation. That is, oftentimes people don't recognize that there are hormonal changes that occur within mammals when a child is born. And you mentioned depression. Oftentimes when there is conception among mammals, this is some amazing work, especially of course men being mammals, but among dogs and other mammals, they've noticed the same thing, that the testosterone level begins to decrease once there has been a conception, right, of their mate, right. And it's important to know that testosterone reduction also is associated with depression. Now, some assume that maybe that is because they are to be more attentive and to be more involved with parenting. I just want to deal with the reality is that there is a reduction typically in testosterone, which is associated with depression. So not only do women have the issues of estrogen and progesterone and other things, but men also have a hormonal shift that takes place, and that contributes to their emotions, and that could influence relationships. So thank you so much for allowing this discussion to at least have a moment to focus on depression in men and how it shows up. It may not show up in the form of immense sadness, but it may come out in the form of anger and other things. And so many times we miss that form of depression. So thank you so much for sharing that. I know we have another guest that is coming in and out. I hope she's here. But if I see your screen, but I don't know if she can say anything. Is that Dr. Edwards, Cecile Edwards? I'm not quite sure who's going in and out. But so here we go. So the topic, gender-based violence and its impact on women. Gender-based violence, and I've already mentioned the social cultural violence, right? The violence that takes place in an environment, the violence of racism, of structural systemic racism and oppression. Those are forms of violence that often do not become to the forefront. We know about violence within a relationship, within typically a man and a woman. We recognize those, but we don't recognize the impact or often the influence of social cultural phenomena and how it influences how I interact with you. Mammal researcher, then we'll kick it to you, Dr. Bruce Golden. Mammal research is this, shows us that there were mice on a grid, and the mice would be shocked. And these mice would try to escape this particular cage. They would try to escape. After they couldn't escape, they would attack one another. Even when they were not being shocked, they would attack one another because they believed that the other mouse was its problem. And we have to recognize that if we talk about mammalian behavior, there are shocks that occur. And I would submit to you that the shock of racism, dehumanization, oppression, are also influencing relationships, which influences how I relate and the idea of interpartner violence. So it's important to capture that picture, but also what happened to us and how we begin to mitigate that is how we see ourselves. So Dr. Bruce Golden, you talk about education among a variety of things, but what has been your experience with this particular topic of violence and postpartum depression?
Well, I think when I think about education, I've had quite a few conversations, even with women who have experienced depression after having a child. And I think, as you mentioned, Sister Olorantoyan, about the importance of education, because if you don't know or have had that space to explore what depression is, how it looks in you, because everybody is unique in how they interpret their own experiences. So I think if you don't have that knowledge of yourself and understanding what is happening to your own body, then I think that can lead you into a dark place as well, let alone trying to, support a baby that you don't feel attached to, or there's a lot of different feelings. And as Dr. Washington mentioned, the experience of the violence of racism, and then you think about how you feel about your treatment in the hospital, your treatment during pregnancy. All of those experiences can lead to, these feelings of the lack of attachment. But I was speaking to a midwife in Birmingham yesterday, and she had been working as a midwife for over 30 years, and just even talking to her about some of the changes that she's seen. And sometimes when you are a sister on the ward, you may not see everything that's going on, but it was until they received complaints from Black women, that's when they were able to identify, the disparities in how they were treated on the wards. So I think it's a complex issue, but I think it comes back down to the lack of equality, the dehumanization, the lack of, pain relief. All of these things affect the experience after birth. And if there isn't that support, if the midwives or if there's not that support after giving birth, then that can lead into impacting on the whole family setup. So the children, then it leads into, if mothers have got children, they're attending school, that distress is going to be displayed in that child, and the fear and the anxiety because mum is not the same anymore. So I think there's a like I said, it's a complex issue, but I think the treatment before pregnancy, during pregnancy, and after pregnancy in Black women need to be explored further, because as we know, that it's all presented from the white dominant Western view. So our experiences, like we've mentioned, will be different compared to what is in the books. And so, we've got that it's a new scope of exploration that I think it's really important that we look into the specific needs of our communities and the differences, because as you've mentioned, every Black person is not the same. So, so we have to appreciate that, and every experience is different. So we can't always presume that, well, you're from here, so you should respond, you should have these views. It's a very unique approach that we need to take.
That's what I mean. Dr. Bruce Golden brings into it, right? This is, we got an echo. Okay, so she said something that the idea of dehumanization of Black women, the social cultural factors that must be looked at. And on top of that, she says that the textbooks may not speak to the pre-existing conditions that we have as a people, right? That influences how we encounter. But the important thing, no matter how you look at it, is the support system. And so I think that is critical. We know again that there's progesterone that is involved in childbirth, conception. We know that estrogen levels shift, prolactin, oxytocin, all these things are happening inside of the body, hormonal changes. What's really heavy about the idea of conception, and of course I never conceived, I don't think I will, but the idea is that the body the woman, and I tell students this all the time, and even my mother on my birthday, that's my so-called birthday, I give her a gift because she gave birth, right? The body has to have this organism attached to it and not see it as an enemy, because the body will naturally attack and kill it, right? And so now you have this organism drawing from this other organism. So it is quasi-parasitic, right? Drawing substance from it. So all these shifts are taking place where the body has to identify an alien object, not attack and kill it, allow it to sustain itself, and then come to bear, right? Come out of the womb. All of those are tremendous hormonal shifts and changes that influence mood, affect, moods, temperament, and all of those things, right? Even impact memory. I talk about, of course, the child birthing mother's brain. It just shifts, right? For me, right, I don't know any man, and I'll be quiet and I kick it over to Sister Oloran, but I don't know any man that would have birth twice, right? After watching my first child come out of the womb, I'm like, if men had to give birth, it'd be like, that's one time and it's done, right? But something about the idea of memory, right? To be able to have all that pain and to watch this woman take and go through all that pain for hours and then hold that child and allow it to be able to nurse. I don't know what that is outside of some hormonal shifts and changes. So we have to give hats off, kudos to women and the process, and understand that there are many shifts taking place where the body is beginning to adjust after childbirth to produce to lactate and so forth and so on. And all of these things can impact mood and sadness and depression, but also enthusiasm and happiness. And we need to be able to monitor that in the context of being people of African descent. So, Dr. Olorantoyan, it is up to you. Tell us more about the empowerment. Oh, no, sister, you were here. But tell us about the empowerment of women and how do you coach them through processes like this?
Yeah. You see, like most of the Black clients, for example, that we have here, they always have concerns regarding the hospital staff, the medical staff, who don't listen to them. They don't have that trust. Yeah, so it's really a big problem not to have the trust. Having the health providers who are from a different racial background, yeah, and not receiving the quality of treatment. So we start basically by providing this safe space where the women are able to know that they are understood, they are taken seriously. I'm sure that you know of the stereotypes which people, I had a case yesterday of a woman who was operated and she had a tube. Now the whole process of cleaning and stitching was done without any anesthetics, because the doctors said, oh, this is something this shouldn't bother you. We have the cases of women who are giving birth and they are left in the room alone, in the theater alone. And despite the fact there are monitors there, they are not even explained what is happening. So this empowerment starts by exploring, what do you need? How are you feeling right now? What is the state? In what state are you? You explain the situation of being in a violent place. Already acknowledging this, that the situation, the atmosphere, it's not very conducive. But what can you do? What can you do as an individual to provide a home for your child? What do you need to welcome this child into this aggressive world? What do you need? What can the community give to you to make you feel nurtured and welcome? So these are some of the things that we try to look at and try to see that actually giving birth here, even being pregnant, can be a trauma. So we ask, what would you do if you were in your native country? What are the rituals that are there? How would you go through pregnancy, and how can we create that for you here? Educating that the emotions, the affect also the hormone production and affect how you feel, how we feel as women, and knowing that we have the power, that there is a power to create these emotions, to stimulate the production of joy producing hormones, and exploring that also with other women together. Often the providers are not culturally sensitive, and this is a very big aspect. Welcoming the mother into the woman into motherhood, and welcoming the child into the world. So these are real challenges to deal with, and we try to go from it in that. I think also this is why I'm really so thankful for what is being done here with the GPAN, Black Mental Health Matters, United States of Africa, because we do need health providers who understand, who know, without a big discussion, without research. They are able to encourage the women in these situations. So this is some of the things. It also includes things like trying to have a network, connecting with other Black health providers to also be a part of the alternative system that we are creating.
Can I say something to what Sister Olorantoyan is saying, Dr. Kevin? She's kudos to you, sis, for doing that. And you're probably not even aware you are doing what is in place right now here in Canada, what we've tried to implement during the perinatal time, basically perinatal time of these pregnant women in generally. There's a concept of adverse childhood experiences. And we, in this discussion, you actually touched on that. During this perinatal time, we have trained nurses educating our patients, looking at these risks. Even, in the perinatal recording, basically the health record, you ask about, are you exposed to any violence? But again, this is a shame. It comes with a lot of guilt in our people. I wonder if maybe we could probably, as Black people, invest in the programs of doulas, where we could have... Yes, we need them, as they will take this process through, because I was looking at actually the stats. We have 10 to 14-year-olds that are dying. They contribute remarkably in the sub-Saharan area or sub-Saharan space. The sub-Saharan area, there's 10 to 14 years. These young girls, I would like to hear actually what you have to say there, Doc, about the schools. How do you, as educators, help these children go through this process of motherhood? How does the school system help them? Because in Africa, there's high rate of deaths between that 10 to 14 years age. So I think investing in doulas would really help during pregnancy, during birth, and after. I think that would help a lot. People that are enlightened, that would help. And also that would help, and being that close to your clients, seeing the risks they have, like this gender-based violence, any alcohol, because when you look at the risks and also the causes of deaths contributing to the mortality rate, it's high blood pressure, which we know you develop high blood pressure due to stress, your cortisol levels, your adrenaline, all these hormones, all these stress hormones, they go up. So that's basically one thing, nurturing those mothers, like you were saying, to help them produce those beautiful hormones of joy. So how do we do that? Involving these doulas, involving more training people from the grassroots, training people who will nurture these women because they are so vulnerable. Because remember, you could have depression during pregnancy and postpartum. We've seen these mothers disconnected from their babies, and we've seen mothers also having some brief psychotic symptoms because of the imbalanced or the hormonal effects. So there's so much that happens. They do need that protection and the care and the love from trained people. I think that's what we could probably start with. I just wanted to add to that because it's beautiful what you started.
Thank you. I mean, that totally is in line with what I'm saying, you know, especially, you know, when the women in a certain environment, the way they are treated, you know, it's not, it sends a message, your life is not valuable.
Yes.
Yeah. They don't get the same treatment or care as they see other people getting.
Yes.
And this is really a big problem.
And they are vulnerable. You know, I've seen even people here, one of my colleagues actually, she said when she cried for help, for pain, the midwife just ignored her. She was asked not to scream, and she actually ended up going for emergency C-section. That's how bad things were because she had obstructed and she was in pain. You know, so I mean, there's lots of stories, and it's sad that it even occurs. Don't think that it doesn't occur to professionals. It happens just by being Black. You know, it's sad. It's happening. And I mean, when you are in that stage of being a mother, you are helpless. So you need someone to advocate for you. So I honestly think as part of our projects, Dr. Kevin, here, we need to invest in training people at that level to get these women to get the support when they are going through this process.
You know, I was hearing that. I was hearing the power of ritual in the context of childbirth, because it is ritual for a certain population to dehumanize African people. That is part of their ritual, right? So when you describe the lack of a sanitized treatment of Black women, or what you mentioned, Dr. Nati, the idea of not identifying with the pain, we know that this has been a ritualized practice of those who have a disdain for people of African descent. That's a reality. But what you also mentioned was the importance of having the women come together and support in childbirth, and the ritual that people would engage in back in a space where we controlled our space. I think that protects us, right, from individuals mistreating our women in hospitals. That protects us from that makes a man have to double take on even trying to aggress against a woman, because he knows that she has some other women that's looking out for her, right? All these things are things that we need to look at. And I do agree with you, Dr. Nati, that we need to look at this idea of ritual. We don't have to call it ritual, but we understand what we're saying. Ritual, when we call these support networks to facilitate bringing a child into the world. You mentioned the adversive experiences that one would have. And what gets overlooked is the impact of racism and oppression. But also, you know, what happens in our homes, right? The idea of domestic violence and abuse and so forth and so on. So we have all those layers of things occurring, but this ritual of women coming together for childbirth, and also men, to understand that we all are going through changes. I don't think that men even know that they go through changes as well, right? We often talk about women, but I can recall with my first child, and then we go over to Angela, but we want to thank, of course, our sponsor, Tunati TV, make sure that they are acknowledged for their support for this. But I remember when my first child was being born, for a day or two, I had morning sickness. And it's like, you know, I'm thinking, what's wrong with me? Why am I having these queasy feelings? I didn't learn till later that men could actually have those expressions, right? We didn't know that we were actually with the child, but I knew something was strange within my body. So my point is that we all have these hormonal shifts, and I don't think we know how to identify them. And so then we can often aggress against one another as opposed to deal with the changes that we have within ourselves. Angela, I think
that comes with it, Dr. Kevin. I've heard men, because of lack of sleep, that's when the anger and sometimes the shift in relationships, because men also, now there's this baby that's crying all night. There's that misunderstanding between them as a couple. There's anxiety. It's a whole lot. Men also experience this, so they also need support. We have the same feelings.
Exactly. Angela, you are with us.
Yeah, sure I am. And there's something I need to ask. I guess you'll be the best person to answer, Dr. Kevin, because I'm wondering, how do you involve the men to also support the women during this journey? Because much as you talked about the women having their circle of support, these women also need the support back home, because actually it does not start at the hospital. So how do we make sure that we mental health proof our homes as well? Yeah, by involving the men and also empowering the men to be able to support their spouses.
Dr. Nate, you kick that off. I know it came to me, but and I'm not afraid of the question, but respond to that. Since you do a lot of work with men.
Thank you so much for that question. I think, like I said in the beginning, we want to go to the grassroots, to the communities. I think we need to normalize these conversations in that level where we have meetings. Actually, I was pleased one time on one of our posts here on the United States of Africa on Facebook. There was a picture of this meeting where it's a club of men. They meet and learn about manhood. So we do need to involve women in those spaces. And I know that there's that patriarchal element where maybe men would think what women want here, but I think we need to probably approach it through healthcare. So once we involve them, and for them to understand even the perinatal classes, we need to invest in perinatal classes. It starts there. For men to also understand. Nowadays, we even teach men how to change a baby's diaper. And I know that in Africa, we have a long way to get to that place. But I think the normalization of bringing them on board. And of course, there's also an element, they are out working in the field, others are working away, but let's normalize and involving healthcare workers to bring them, because at least they will have a voice. And also organizations like us that are impactful in the organizations to bring these conversations, normalize the campaigns, understanding that this is existing because the child is not just about the mother. Nowadays, we even allow men to come into labor ward and connect with the baby and put that baby on the chest because that baby needs that connection. So I think that's where we need to do, and also putting structures to help with domestic violence or substance abuse. Yeah, I know we're still struggling with that, like rehab centers, because there's so much. Like I said, we still need to address also the individual needs. Like I said, men, when they are depressed, they become violent. Some men become violent and aggressive. So we also need to take care of their needs in that angle. So it's so much. It's packed. We just need to involve the governments, of course, also the the NGOs, NPOs on the ground. I hope I answered you.
No, I mean that was really good. Because my support for your statement is that we do manhood training programs, and so initially they want to do fatherhood training, and I say that if we do the manhood training, then they'll understand how to be a father.
Exactly.
So not the other way around. I don't think that every fatherhood training program teaches you how to really be a man, right? And so a part of the manhood training conversation, and this is part of our rites of passage that we've lost, I think, some of it because of our traducers, but we learn this idea that you have existence, you have agency because of the life that comes through and from you, right? And that comes through the mother. And we have these clear signs of understanding this within ancient Kemet thousands of years ago, because we see that the women didn't go to school in ancient Kemet because they say that the schools were designed to teach you how to become more divine, and that women were already divine, and so that because nothing could take life into its body and gestate it and pass it from its body and sustain it till it can sustain itself, but woman. So woman was seen as divine. That's why in the so-called Roman Catholic Church, you see Mother Mary construct, which is actually borrowed and taken from African reality of understanding the power of womanhood, which means somewhere men understood the relationship between men and women and childbearing. That's my point, right? So people miss the deep dive conversation that we have it and we still have it, but we've become disconnected because we follow a Eurocentric model that detaches from women. And so for them, the idea of competition with women is essential. But if we are together, men and women fight the battle of the sexes, nobody wins in that process. And I tell my wife all the time, if we argue in battle, who wins, right? Because out of the love that we have, we're losing out. And so I think then, Angela, to your question, is that the return to ritual and processes that inform us as men, what it means to be a man and what it means to bring forth life, and what does it mean to be a co-contributor to life, and not just simply saying that it's the woman's child, right? And we know the men of our societies have societies in which the matriarchal, matrifocal, with women and also patriarchal. But the point here is that no matter where you go, it takes both men and women to create children, and it takes that same energy to bring them to health and adulthood. So it's a reclamation of our true identity and not the alien construct of the oppressor. I think is very important to engage in. But Angela,
also reduce the teenage pregnancies we're seeing. Like when I looked at the stats in Africa, I couldn't believe it, to have a mother age 10 to 12 to 14. And remember, these kids, out of shame and guilt, there's also the illegal or the unhealthy ways of doing abortions. That's another form of contribution to this mortality rate we're talking about too here. So I think we need mentors, to be in that space, involving schools too, right? To be impactful in that space of educating kids and prevention of teenage pregnancy would also be helpful.
Indeed. Again, thanks to our sponsor, Tunacheki TV. Angela, introduction of yourself, and you came in with the strong question. So
I'm actually also I'm Angela. The name is already there, and I'm a mental health activist, and I'm also a mindset coach, and I'm a psychiatric survivor, and I'm so glad to be part of the team. And from our discussion, at least what I have learned so far, although I was on and off, is that it's very important to have the guys on board, but also because I went through all the profiles of all of the panelists, and I was so curious about Sister, because you say you're a psychosocial counselor and artist. So one of the things that I want to find out from you is, how do you support the women to use art as a therapy? Because when you're going through stuff, when your emotions are all over, because I've been there on that journey. When my child was 9 months, that's actually the first time I got the mental health crisis. Then the next time when I had a baby, and I got the breakdown when he was 4 months old. So how do you engage the women, or how can the women use art as a therapy so that they are able to overcome that season when they've had that mental health crisis, so that they are also able to reconnect with their children and also be able to reconnect with the rest of the family? Yeah.
Thank you so much. Well, using art, first of all, I try to define the art, meaning the expression of that which is in your innermost spirit. So I explain that everybody is an artist. Everybody can create, and everybody can express. In the case of negative feelings and emotions, we use the art to bring out all these emotions.
Yes.
We do say that it is the secrets that make us sick and make us heavy. So there is certain tools and practices which we have. where it is okay. Everything you are feeling and everything that the women want to express, to create a trustful space where they can bring that out. And the woman herself decides how. We had the case of women who were violated by the police. And she had pains which were not going away. And there was the talk of an operation, but even that took time. So in our sessions, first of all, she was allowed to speak about what had happened to her and know that she's not judged and know that the space, she's talking to somebody who can contain it. So often women talk, it's not, our communities, our traditional communities had a lot which has been destroyed. So this having a space where women could come and talk to the elders or to some older women, we don't have that in our modern societies anymore. So the women come and they can talk and they see it's okay to talk. There is nobody giving advice, because often we do that in our private settings at home with the husband or with our friends, but they themselves are overburdened with these traumatic events and sometimes try to give solutions or advice which don't work. So the first thing is to say, in you, you have the power to overcome. That is within you. You have the power to overcome and to deal with the situation. So what is very important is to look at, first of all, to put out what has happened to you. And then let us look at it from all the different angles. And after you have understood what happened to you, then you can now express it and create a healing space for yourself. So things happen, but there is guilt. Even though I was violated by the police or there was a rape, people carry the guilty feeling still. In the subconscious, there is something there saying, if I had done things differently, this wouldn't have happened. So this is important, first of all, to bring that out and to realize everything, I am okay as I am. You are okay as you are. You have done nothing wrong to deserve anything other than well-being. Pain can also be expressed through sound. So we look at the pain, we say, where is this pain? Where is it sitting? When did you first have the pain? What were you doing when the pain got there? We explore, what is it like? When can you observe this pain? Really observe it for a few days? When does it get worse? When does it get less? And using the voice, for example, you can scream, you can sing. Is there a melody which you can take this out of your body? Is there, what other emotions are connected to this? Is it anger that you want to express? And all this is okay to bring it out. You can use the voice. We can use sometimes paper. And sometimes we can use the body, or combination of all. So these are some of the ways of dealing with such situations. And sometimes even without thinking, just doing is already healing. So you have somebody who doesn't want to talk or express, but if she can just decide, does she want to paint? Does she want to move? Or does she want to sing something? That sometimes is also a way. Singing without words, singing without any sense. Only the body already producing this sound and bringing it out has an effect. So these are the things we try to tell the women. And in the group, it is very, very strong because they hear the others and they share and they support each other.
That was beautiful, sister. It's interesting because I'm nodding because my partner is an artist too, and he uses art, sound therapy. So I'm familiar to that. And with the work I do in mental health, I utilize his art so much. And also, recently, he introduced me to somatic therapy too, the power of touch, Sister Angela. You know, when she mentioned where is the pain, the power of touch, even the hugs from some from another person, another woman, it's beautiful. It transfers those happy hormones. So it's something we can utilize, you know, in this walk. I know Dr. Kevin had to step out. He has other commitments. So I'm going to take over here. You know, the other thing I would like Sister Angela to share with us, what are the challenges you see where you are for women that increases risk of the deaths? Because when I looked at the stats, more especially in our globally, by the way, in 2017, the latest stats, we have 295,000 deaths every year. And the big chunk of this comes from our African space. And 1/3 of it comes from South Asian countries. But sub-Saharan African space is still high. What are you seeing in your community, Angela?
In our community, it's mainly about accessibility. That is a major problem, accessibility to healthcare services. And apart from that, it's also the cost, affordability, because not everybody can access the places which are free. Government hospitals can, yes, give you a bit of free services, but there's also bribery within the hospitals. So also people, not everybody can access the hospital, lack of information flow, awareness, because when we talk about postpartum depression, many people are ignorant about it, and they will ignore it, and they will tell you this is not an African thing. And many people will consider issues of mental health as issues which are a luxury for white people. They say these things don't happen to Africans. And yes, here in Uganda, yes, it's Uganda, we are in Africa, East Africa. But yeah, well, that's the attitude and the stigma as well. Because I recently engaged with a friend who talked about her experience in Zambia. And she said one of the people, a lady there who was ill, she's mentally ill, but for her to be able to access health care for her mental health, she has to go all the way to South Africa to get her medication. And it's because she can also afford it. Because she says when she tries to get it from home in Zambia, people laugh at her, people put her down. And so the space isn't friendly for her to get access to the healthcare. So those are some of the things. But of course, also in addition to that, you had already mentioned it, the teenage pregnancies. Children are young. And during this season of COVID, a number of them got pregnant. Yeah, some of them might be able to have children through natural childbirth, but most of them can't. And frankly, healthcare is expensive. I guess that would even be a problem globally, but healthcare is still expensive. So those are some of the major issues in Uganda.
You mentioning that, I went to Uganda. Actually, I was in Uganda in 2016 for medical volunteer work, and I witnessed what you said. I was working in the labor ward. You know, like you said, it's expensive. Women had to bring their cotton wool, the big cotton wool, all that big batch of that. They needed to bring their medication. I felt bad for those that had high blood pressure, who had eclampsia, which is severe hypertension, high blood pressure, which has, you know, complications of seizures. You know, they would get the dose during birth time, but after that, the continuity, they ask their partners, their relative, to go and buy it from outside to bring it in. And those women, they had to be in the hospital for a few days to monitor that blood pressure, but not with the hospital money or, stock. I was shocked, and some of them, they were telling me that now you have an obstructed labor. There's no electricity in Entebbe. I was in Entebbe. Now they have to rush them to Kampala. Oh my gosh, it's so tough to get them rushed because, first of all, some don't even have money for the ambulance. The government could say, we have the ambulance, but do you put petrol on it? So what if you don't have? So there's so many things that contribute to a lot of complications. And like you mentioned, the transportation too is a big factor. So we probably need to invest in air ambulances. Black mental health matters here, right?
We definitely need that.
Yes.
Yeah, and when you talked about power, electricity being off, you reminded me of an incident I personally experienced because I was in a private hospital, but when it was after the delivery of the baby, there was no power, no electricity. So the midwife, had to work on the stitches using her torch of her smartphone. I don't want to mention the hospital, the name of the hospital, but it was a private hospital. I was not even in a government hospital. So that is to show you how bad the healthcare system is and how much needs to be done.
Yes.
Yeah, because this is a situation where I could, and I still can afford to pay for the service. But this is what happened. So you don't want to imagine how bad it gets for people who can't actually afford it.
It's powerful because you sort of hearing you makes you sort of see how much we have in the UK, in England, and how you can take these things for granted. You make a phone call, the ambulance arrives, they have to keep within, they have to do what is expected of them. Otherwise you can make complaints or, and even when we think about just the process of childbirth and the hospitals that have the amazing equipment within the hospitals, you paint it's another world. It definitely is another world.
It is.
But also, recently, it's so great to have Black Maternal Health Week because in America, this is what's going on as well. But we can see that in the UK, in England, Black women are 4 times more likely to die in childbirth as well, and pregnancy. So that same disparity is there, no matter if there is wealth within that country. You can see that the same things are happening in countries all over the world. And so, it just really, jumped out to me as you were talking about those things that we switch on the light, we have light. It's very touching, and also it makes me see how it's so important that governments invest in the countries, and we need funding to support. I think the needs are just so great. Even what you're doing, sister, in Germany, just you painting, I'm trying to paint that picture of women in one space where they feel that they can express themselves and say there's no guilt. And for you to create such a safe space for them, that's life-changing. And you can see how that will impact on how they interact with their children, and just how that cycle of, goodness will continue. But without that space, the amount of tension, stress, anxiety, all of that in these bodies, health problems again, we're back into the hospital system. But thank you, Angela, for sharing, and the amazing work that you're doing, Dr. Unati, with men as well. So it's almost like the whole family somewhere along the line is being supported, and it's great. And I think, like you said, working in the community is so important. And myself and colleagues, we do projects, and we have a group called Nakuona, which means I see you. And from last year, we've been trying to, with the virus, we haven't been able to do anything, but we held an event and invited women, and men came along as well. But it's mainly to say to women, I see you. You don't have to have a big social standing. You're in the community. Someone might say, look, this woman is doing this in secret. She's not doing it for any kind of accolade or anything. She's doing it because she cares. And I think that's a beauty, you know, within our communities when we can do things like that and see a difference. So,
you know what I like about us as Africans, we already have that extended family structure. You know, if we could get involved and get back to that love, you know, that oneness and that helping each other, I think there's a hope, you know, to develop these projects and for them to take off. And I would love to see more women involved in also being in the spaces where there's men, because I've been received beautifully by men. And I think once we come with that maternal energy, that maternal energy, that love, that, you know, I hear you, I want to hear what is it that makes you behave a certain way. You know, I think we need to start asking what happened to this person rather than saying what's wrong with you, because you put everyone on defense once we approach it that way. So I think we need more women, because we birthed boys. You know, we birthed them and we loved and nourished and nurtured them. So we need them again back in that space to be okay. And also we need to also educate women as they raising these boys to nurture them the same way as they do with their baby girls, because also this is also inflicted on boys. They're not wanting our boys to express their feelings. They're not wanting our boys to be, you know. So I think it starts there, because these angry men we're meeting in adulthood, these are boys that repressed and basically suppressed their feelings when they were young because they were told not to be sissies. So there's so much. That's why I'm saying it's important to get women in the spaces of men and also educate. Actually, you know what? I recently did a survey on my LinkedIn and I asked men, when your child is sick, who takes the child to the doctor? I was pleased, actually, 50%. Initially, it was 80-20, and then it went up to 50% that men now, they're starting to take their children, boys and girls, to their doctors. So those are the little things that we need to start involving men. I think that role of leadership that we have put on men is also playing a big role in them not coming in their vulnerability when they're suffering. So I think we need to work together, and there's a chance, because we come from that background anyways. As Africans, we are loving, we are nurturing. We just need to rebuild those structures because they were there. And I'm glad, you know, honestly, sister, in Germany, for you to do such work. I'm so proud of you. And I think we need to applaud what you guys are doing up there, because our women are experiencing the same, like you said, down south, Black women are dying like 4 times more than their counterparts. It doesn't matter what background you come from. When you look at these women, they are dying from things like breast cancer too. They fight. I was listening to this lawyer who said, I got to do mammogram because I'm a lawyer. I fought for myself's right. What about the other woman who's out there, you know, who cannot do that? Recently, we lost a colleague last year, a pediatrician in training. She died because of complications. We don't know what happened there. So we need real good support, because it's a big global pandemic or epidemic. The racism, it's terrible. You know, we need. Go ahead.
Sorry, you know, I was thinking as you were talking, I was thinking about the power of the media, the television program, you know, the world. You can have a home where you nurture, you give love, and then they go into the school and it's another world. They're watching television. It's another world. There's an expectation of what a man should be like, and it's complex, and it's a battle, because you can have a home where you think you've invested and you've done, but then there is another world. There are other worlds out there that young men will be drawn to feel like more of a man, and it's these things that need to be unpicked as well. Culture, you know.
Yes.
What is the media saying? And the strength of the other side of saying this is how a man should be, what's acceptable as a man.
Yes. We want to see more of people that look like us on social media, on national TVs, so that our children see role models. We don't, because we don't see a lot. Like I'm still waiting for one of the national TVs here. I wrote to them. I said, I don't even see an advert of a Black professional on a bus where everyone is going. I see a whole lot of other races. Can we also put us? I would like to see a doctor there, a Black person who looks like me, for my children who hop on that bus, for my people's kids who hop on that bus, to see that, yes, right? I would love to see that. I would love to see us on big spaces, because our children have no role models. People that look like them are not in spaces where they could see. Like you're saying, Doc, TV is a big media where our kids, we don't want to, our kids are showed Black men who are in jail. That's all that is amplified in the world. We want to see more Dr. Kevins out there for boys. You understand? So there's so much that could happen. I see our viewers here, Claire, saying the healthcare system down here in Uganda makes people vulnerable. Thank you, Angela, for hitting on that one. Thank you so much, Claire. That's beautiful. I don't know if you sisters want to add something. We're going to close here soon.
I think, you know, as everyone's mentioned, I think sister as well, the main thing is education and providing spaces for people, children, mothers, fathers, having that space to be able to express themselves without feeling judged. And the beauty of just having that time to look at yourself and say, you know, how am I really feeling?
Yes.
And I think that's so important, because if your parents, as a mother, you know, you suppress everything because everyone comes in front of you. You've got to look after the children. You've got to look after your husband. You've got to do this, everything. And you don't stop sometimes to think about what is going on. And that's probably exactly the same for men. So I think it's so important that we create spaces where we can thrive and feel comfortable in spaces with other men and women that look like us. So
Yes, wonderful. I can't wait. I'm actually part of this beautiful community. I just joined here. There's a mentorship program that's coming where we're gonna put together youth and seniors, and we're gonna expand globally. I can't wait to introduce Japan to that. It's beautiful because we see the need of young people getting all the knowledge and the wisdom from the seniors, the elders, and that's how we are raised, you know, as Africans. So it's beautiful to see it coming from this perspective, this Caucasian or this Western perspective, to see the need of these groups that could work together. I think it's gonna nurture the world. I think the pandemic has brought so many ideas to us to recreate and just look what really matters, really relationships. You know, I always go back to the 70-year-old study in Harvard that everything is all about relationships. And how do we build and rebuild those relationships? It's building our wellness, our mental health. How are we going to show up, you know, to our families, to our spouses, to our children if we are unwell? So I really thank you guys for coming to this space, sharing your beautiful advice and your work that you're doing. Keep doing it. Sister, what do you want to say? What are you doing in Germany? I just love what you do there. You're just amazing.
Thank you. You said a very important thing, that is well-being and self-care.
Yes.
Of taking ourselves seriously as women, giving that self-care, and then knowing family care is self-care.
Exactly.
We have to take care of our families, men and women, together, sharing the leadership and making sure we have that space.
Yes.
Yeah? And we take that to the community, and we see the problems are global.
Yes.
So we have to connect and deal with it also structurally, like we're doing now. And I'm so happy to be a part of this. Yeah.
Yes, we're happy to
all of you. This is very, very empowering.
Thank you.
Yeah.
Awesome. Sister Angela, you want to have a final word for us here, please?
Okay, the final word, I would love to see maternal mental health care streamlined with all the different kinds of healthcare systems And not just because Dr. Bruce, she's privileged. So her situation in the UK is different. But now I want it to be in such a way that here in Africa, especially now I'm speaking also for my country, Uganda, I would love to see it that when the mother goes for her antenatal or even after the delivery of the baby, that aspect of her mental health status is also assessed, because we have also had situations in our country where mothers have actually drowned their babies, where they've hurt their babies and killed them, and people will be quick to maybe take this woman to prison, or she might also have committed suicide. And so people don't understand it. The person is labeled, and yet if you investigated further, probably all she needs is help. And she will be able to function effectively and productively as a mom. And I want to see the stigma and discrimination reduce dramatically, drastically, because people are afraid to seek help. First, they also don't understand what's happening to them. Second, even those who do, they don't know how do I even begin to ask for help. People will think I'm weird. I want to see more of the stories out there and people seeking more help and more support from also our government systems. Yeah, that's my last word. Yeah.
Thank you so much, sister. Yes, in closing, to our viewers, thank you so much for watching. I can see people are still on, but for some reason, because Dr. Kevin was the main host, I'm unable to pull the comments. So I apologize. And before we close here, I can't close without thanking our sponsor here, Tuna Cheki TV channel. Thank you so much for what you did for us. We really appreciate. This is the beginning of a good relationship to work with you, because you have a beautiful community there. We want these discussions to reach every corner, not only just Africa, every corner where there is any Black people, we want to reach them. And also, I would love us to create spaces of safety, like Sister Angela was saying. We want to protect the vulnerable group, women and young girls, when they are going through pregnancy and postpartum. There's risk of infections, the stigma that comes with it, and also the abortions, done in the background. There's so much, the high blood pressure, the education of antenatal care. There's what we need to do. So I want to take this opportunity and thank everyone who's watching us. And we are promising, as the community of Black Mental Health Matters, these are the things that we talk about in the projects that are coming here as we put things together. Of course, this pandemic is kind of limiting our movement, but I'm grateful for us to create such a space here to do things virtually. There's always a beginning of good things. So this is basically what we've started, and we'll continue doing this. As you all know, if you are not a subscriber here, join us every Saturday. We come here at 5 p.m. East African time and discuss issues that matter to us, Black people. And this is not just directed to the African space. We are directing our discussions to everybody in the diaspora, in the Caribbean, in South America, everywhere you are. This is for you. So join us, and if you want to be part of us, just contact us. We have our contacts here on Facebook. Be with us, come join us. We want to do this together. We cannot succeed if we're just doing it, running with it as just individuals. That's why we are this big team. We want the best for our people, and we believe, as we are aware now of these issues, we need to have funding. If you are any sponsor out there watching and you love what you saw, would love to get support from you. And once again, thank you so much to the panelists. Thank you so much for your time. Thank you so much for the wisdom you shared here. We really appreciate you. And I'm hoping to continue this, because we're hoping to continue it even in May, when there's the day of the Maternal Mental Health Day on the 5th of May. We'll come back here and have another discussion, because I would like us to also talk about the other issue we didn't touch here, the issue of genital mutilation. Female genital mutilation is playing a big role in women's health and also in the maternal health. So we're going to talk about stuff like that in depth. I have a speaker I have in mind who is a big advocate of that. Thank you so much again for your time. God bless.
Thank you.
Thank you.
Thank you.